Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
Annabelle also writes, how do you recommend avoiding the dental arch in certain dental radiograph images? And Maria kind of had the same question, and then tips for brachycephalics, have a harder time with the back molars. So when we're primarily in the cat with that zygomatic arch, we want to change our angle a little bit, and in the dog we were shooting that at about a 60-degree angle off the horizon and coming up above and down through those molars. With our kitty cats, we're going to lower that angle substantially, and we take that at about 30 to 35 degrees, so it's much closer to the horizon. So we're kind of sneaking under that zygomatic arch. And this is kind of an illustration of what those two views look like. On the left, we've taken it at that steeper angle of probably about 60 degrees, and that zygomatic arch just kind of gets superimposed right over those molar and premolar. And the photograph on the right is a much lower angle. You can see that we can't get rid of that zygomatic arch 100%, but a lot of that thick bone has kind of moved up or dorsal to where our teeth are. So we get a much more diagnostic image. So that's going to kind of be your go-to to eliminate as much as possible that superimposition of the zygomatic arch. For those last molars on any breed, we're going to want to have our sensor positioned in such a way that it's underneath those molars with the crown sitting just at the edge. And sometimes those brachycephalics, we kind of have to turn that sensor in toward the palate a little bit more because the back of that maxilla kind of curves in like a C at the back there. And then we're going to want to position our tube head where we're going to want to have it positioned again about 60 degrees off the horizon, but use that oblique angle, a back to front oblique, to throw the shadow forward onto where that sensor is. Because a lot of times we can't get that sensor completely behind that last molar. And so we're going to use our sun or our tube head and throw the shadow forward where we need it onto our sensor. So it's just a real subtle oblique back to front, and that will help get that last molar every single time. Chrissy writes, do you have any tips for getting good shots of 110 and 210, particularly on large dogs? Also the 11s as well. And again, in the caudal mandible, we have teeth that are sitting on that ramus, which is curved to some degree. And so when we take that shot, if our sensor isn't placed to compensate for the curve of that ramus, we typically will cut off that last molar in the mandible. And so this will kind of illustrate what I'm kind of trying to describe here, where that last molar you can see is kind of right at that curve. And so my mandible is upside down because my patient's going to be upside down. And my sensor is placed in such a way that it's following the curve of that mandible. So we'll place that again, vertical. That's our parallel technique. We're still going to have our beam perpendicular to that sensor, but we're just going to give it that tilt for that first shot in the mandible to compensate for that curve. And you'll get a nice view every time, just by making that one adjustment for those caudal teeth in the mandible. Megan asks, do all dentals go home shortly after recovery, even with extensive extractions? Other than longevity, what makes bupivacaine your local anesthetic of choice? Yeah, our patients go home pretty much within about an hour after we're done. With only working in the oral cavity, we're not opening an abdomen. We don't have a joint open. We don't have to do, prolonged pain management, CRIs with most of our patients. Some we do, but only working in the oral cavity. Once they're awake, they're perfectly okay to go home because of the agents that we use that are metabolized relatively quickly, other than the narcotic, and everything is sutured closed. If there's going to be any emergent bleeding in the mouth, which sometimes happens if an artery is nicked, in the mandible, if we're going after a root or something deep in the mandibular body and that artery gets nicked and we've got some pretty brisk hemorrhage, we're going to address it in surgery, or we're going to see it immediately in post-op. And so after an hour, everything is pretty much clotted. We just don't see patients go home and just all of a sudden start bleeding or decompensate. The way that we have these patients maintained under anesthesia, the way that they recover, they're fully awake. I have patients that I walk up to the front, they're pulling me. They're pulling the leash to get up to their owner, tail wagging, and the owners again are pleasantly surprised because their pet is so alert and so awake, and that's how we send them. It also minimizes anxiety both for the patient but also for our pet parents. The less time that they're away from their pet is going to be much less anxious for them, and hopefully will make them more compliant in returning and having follow-up procedures done, like our 6-month prophies or our 4-month prophies, or those perio patients that we need to come back multiple times. So we want to make sure that we're making this as pleasant and as easy for our owners, and there's no reason that we need to keep them till the end of the day. They're awake, they're ready to go, and off they go. So again, with our bupivacaine, longevity for sure, but we've recently switched to the Nocita, which is a little different formulation that allows for consistent 72-hour analgesia, which is wonderful for those patients going home. All right, I've got a question from Nicole. I'm still very new to the technical side of veterinary medicine. I saw that you flipped the cap when getting the dental rads for the mandible. Should that be practiced with dogs as well? Yes, and we talked a little bit about that, but we are going to have them sternal to image the maxilla, and then we're going to have them dorsal to image the mandible. And then while they're still in that position, we're going to do our gross evaluation, a quick cursory cleaning so we can look for pockets and discolored teeth, fractured teeth, oral masses, changes in the mucosa. All of those things are very, very easy to see with them in that position. But for radiographic positioning, absolutely, it just makes it so much easier for placing the sensor, for troubleshooting, and helps speed up getting those images for that first part of that procedure.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.